Hi, my name is Albina Kolesnik, and I am hoping to become a physician assistant. Starting with the scope of practice, physician assistants are nationally certified and state licensed medical professionals who work under the license of a physician to provide medical care to patients. Physician assistants are able to diagnose, make treatment plans, take medical history, and in most states prescribe medications and much more. Each individual state determines the scope of practice for a physician assistant through the state licensing requirements. In rural areas and undeserved areas, physician assistants may be the primary care providers at clinics where a physician is present only a few days a week. Your interaction with other professionals depends on the setting you choose to practice in. So whether it be a hospital or a clinic or urgent care center, you will always have a team of workers that you collaborate with. The daily duties of a physician assistant could include things like taking or reviewing patients' medical history, examining patients, ordering and interpreting diagnostic tests like x-rays and blood tests, diagnosing a patient's injury or illness, giving a treatment, or educating and counseling patients and their family members, prescribing medications in some states, and also assessing and recording a patient's progress. The work environment for physician assistants depends on the setting that they choose to practice in. So whether it be a clinic, hospital, a nursing home, a medical office, or even a research center. Judging from these options, working conditions are in a comfortable setting, always indoors, where physician assistants spend a lot of their time on their feet, making rounds and evaluating patients. Most students have a bachelor's degree and about 3 years of healthcare experience before entering a program. Most programs are approximately 26 months, and most of them actually award a master's degree. When it comes to examinations, all states require physician assistants to be licensed. So to become licensed, candidates must pass the Physician Assistant National Certifying Exam, PANCE, and get it from the National Commission of Certification of Physician Assistants, NCCPA. So to keep their certification, physician assistants must complete 100 hours of continuing education every 2 years. The recertification exam is required every 10 years. For clinical hours, PA school is different from most of other health professions in that to be a competitive applicant, it often requires a very large number of hours of paid healthcare experience. You'll also complete more than 2,000 hours of clinical rotations in the second year of PA school. As mentioned earlier, recertification exams must be taken every 10 years, and 100 hours of continued education must be completed every 2 years. So PA profession enjoys not only the support from national medical groups, including the American Medical Association, but over the last few decades, there's been a rise in numerous organizations dedicated solely to the promotion and support of physician assistants and associates on a national and local levels. So the most known organizations would be the AAPA, American Academy of Physician Assistants. Students that graduate PA programs are encouraged to become members of the Academy and have the opportunity to participate in the continued development of their PA profession. So when it comes to medical journals, the JAAPA and the JPAE, it includes clinical reviews, articles, case reports, and research articles that help a physician assistant learn and advance in their career. Moving on to my timeline, very briefly, I'll discuss that I'm going to start studying for my GRE exams about August 2020, May 2021, even though I kind of already started studying for them, but this is more intensely. So by May 2021, I'll be able to graduate from University of South Florida with my health science degree. So I want to take my GREs by June 2021 and begin to apply in PA program by July 2021. So then hopefully by August to October 2021, I'll be getting interviews by the PA program. And as I am continuing with my patient care experience, by August 2022. Hopefully, I'll be getting orientation to PA school, and by late August 2022, I'll be starting my first week of classes at PA school. So, 5 years from now, by April 2024, scary, I'll be preparing for the PANCE exam. So, it's going to be a long journey because I am working full time. For my job search plans, my plan A is to work with my mom, who is a physician, and she's opening her own practice by next year. If I choose not to live where she's opening her practice, my plan B would be to apply to 2-3 jobs at a time, and to always know your worth before accepting any position. So really know what you're applying for. And then here are my references, and that is it.